Congress is sleepwalking straight into a healthcare disaster, and Senator Maggie Hassan is practically shouting from the rooftops trying to stop it. With just weeks left before millions face skyrocketing premiums, she lays out exactly what's at stake and how political games and even a single billionaire's tweet helped push us to the brink. This is the part they don't want the public to understand.
Senator Hassan.
Well, thank you, Mr. Chairman, and to the ranking member for this hearing. Thank you to our witnesses for your care and your expertise. I want to start by just echoing what I think we've heard on both sides of this dais today, which is there is a lot of agreement on things like price transparency, something I've worked on with Senator Cassidy, on PBM reform. There's a lot of good ideas about ways to lower the overall cost of care. But we also know that one of the ways you lower the overall cost of care is to make sure that people get the preventive care they need and get their care at the right end of the system. And as important as these bipartisan ideas are right now, I do want to emphasize and agree with my colleagues who have pointed out we've got like 3 weeks to solve this. Open enrollment for people who need coverage starting January 1 ends on December 15th. If you're waiting for February 1 coverage, it ends on January 15th. We are running out of time, and in my own view, this means we do have to do a short-term extension straight up. There are a couple of reforms on the enhanced subsidies that I think there's some bipartisan agreement we might be able to get to, but we need to do that right now and then think about what's next in terms of overall cost reduction. But I do also want to make a couple of other points. The PBM reform that we're talking about, that was in a bill that was ready to be passed on the floor of the United States Senate last year until Elon Musk vetoed it. One tweet essentially vetoed what was a bipartisan bill. And so I just think we all got to return to some of the work that we have done and get to it, understanding that it's come through the committee, understanding that it reflects a lot of bipartisan work. The other thing before I get to questions is I do want to acknowledge, one, how difficult and broken the system is right now, but also what it was like before the ACA, because I think there's been some amnesia up here. Before the Affordable Care Act passed, my constituents who had pre-existing conditions had no option for insurance. Senator Houston said there's only one insurance plan for some of his rural constituents. That's becoming a real problem in New Hampshire, too. But before the ACA, people with pre-existing conditions couldn't get health insurance, full stop. Before the Affordable Care Act put Medicaid expansion into place, which my state adopted on a bipartisan basis, people who needed addiction treatment couldn't get care. People who didn't work enough hours to be counted as a full-time employee in their employer, maybe because they had caregiving responsibilities that they weren't paid for, couldn't get coverage, but Medicaid expansion allowed them, people who were working, to get coverage. And the Affordable Care Act, to the point that I just want to emphasize, it covers preventive care at no cost. So I want people to understand that even if you have a high deductible, and we do need to bring those deductibles down, you can get preventive, life-saving preventive care because of the Affordable Care Act. That was also not true for a lot of covered folks before the Affordable Care Act passed. Now, my office recently heard from one of my constituents named Karen, who lives in Bow, New Hampshire. She will have to pay $200 more each month in order to keep her health insurance next year if we don't extend these tax cuts. However, Karen's family can't afford to pay those higher premiums. She can't afford that extra $200 a month because of the rising cost of groceries, energy, and housing. She can't afford it unless we do something. So, Dr. Fegan, what action can Congress take to ensure that people like Karen and her husband can afford their health insurance on January 1? And have you heard any proposal discussed here today that could lower my constituents' premium payments in 2026, which is just 4 weeks?
I think the logical thing is to extend these subsidies that currently exist. I can tell you that I've had patients I had a nurse's aide who went without insurance and came in with a sore throat she'd had for several weeks and turned out to have inoperable throat cancer
Thank
because she made that decision.
Yeah, I appreciate that, and that's one of the things we're trying to prevent. One last question for you, Dr. Fegan. As I mentioned, before the Affordable Care Act, insurance companies they could deny pre-existing condition coverage for people with pre-existing condition. They could also set an arbitrary lifetime limit for patients, meaning that they could deny a claim once that limit was reached. Now, some of the testimonies submitted by the other two witnesses here today suggests that we should reinstate lifetime limits in health plans, meaning that insurance companies could stop paying for care for a patient with a chronic or pre-existing condition. So, Dr. Fegan, can you talk about the dangers of lifetime limits on care that we saw prior to the ACA?
I can think of nothing worse than telling a patient who survives a horrible diagnosis of cancer and we cure, and then tell them they are no longer eligible to get insurance should they have any other problems. Before the ACA, 80% of our outpatients and 56% of our inpatients were unfunded at Cook County. So it's made a world of difference for us.
Thank you very much. Thank you, Mr. Chair.
What Senator Maggie Hassan is doing here is cutting through the noise and reminding Congress of the very real human stakes behind these policy fights. She isn't talking in abstract terms or partisan talking points. She is sounding an alarm about a deadline that will hit millions of people like a freight train if Congress keeps dragging its feet. 3 weeks, that's it. 3 weeks before people start losing access to the ACA tax credits that keep their health insurance even remotely affordable. And this is crucial. She makes it clear that this isn't about ideology. This is about timing, urgency, and the reality that healthcare doesn't pause while Congress debates. The cost of groceries, housing, and energy has skyrocketed for regular families, and for many people, the ACA subsidies are the only thing keeping them from falling through the cracks. Hassan brings that urgency into the room by naming an actual constituent, Karen from New Hampshire, who will see her premiums jump by $200 a month if Congress fails to act. That number isn't political, it's not theoretical, it's kitchen table reality. And you can feel Hassan's frustration with how these bipartisan reforms, like PBM reform, were ready to go until a single billionaire's tweet derailed the entire process. That moment exposes something deeper about the current political system. Good policy can be stopped instantly by someone with zero accountability and limitless influence. Hassan is calling that out as a structural problem, not just a political one. She also does something essential. She reminds everyone what life was like before the ACA. People with pre-existing conditions were simply shut out, full stop. A cancer survivor could be denied care permanently. People working part-time because of caregiving responsibilities had no pathway to coverage. And Medicaid expansion, adopted on a bipartisan basis, opened doors that had been locked for decades. By bringing this historical context back into the conversation, she's not just arguing for policy renewal, she's arguing against political amnesia. So many lawmakers forget, or conveniently ignore, the human suffering that existed before the ACA. Hassan refuses to let that memory fade. And when Dr. Fegan steps in with the story of a nurse's aide who delayed care due to lack of insurance and ended up with terminal cancer, that's the entire conversation in one tragic example. This isn't a theoretical debate about budgets or subsidies. It's life and death determined by whether Congress chooses to act. Hassan's warning is simple but powerful. Congress cannot keep delaying. The consequences are immediate, measurable, and deeply human. And her closing questions on lifetime limits strike at the heart of this debate. Because going back to the pre-ACA world doesn't just raise costs, it resurrects the cruelty of an insurance system that punished people for surviving an illness. What she's trying to get across is that healthcare isn't just a policy arena, it's a moral one, and time is running out. If you want leaders who understand the real-life impact of healthcare policy and refuse to play games with people's lives, keep supporting independent platforms like Left Lens. Make sure you like, subscribe, and share this breakdown so more people understand what's actually at stake in these hearings.